Welcome to Virginia Medical Updates. My name is Alejandra Gonsalves, and today we're here with Dr. Liana Abramova. Welcome. And this is just a reminder to let you know that our program today is sponsored by Virginia Family Medicine. Virginia Family Medicine integrates functional and alternative medicine in their practice to complement their expertise in medical care. Their areas of focus are in preventative medicine, holistic health, and weight management. So Dr. Liana Abramova has a medical and cosmetic practice in Fairfax, Virginia. She has been in practice for over 15 years. Originally from the former Soviet Union, she attended UVA for her undergraduate studies and Emory University in Atlanta for medical school. After she finished her residency at Washington University in St. Louis, she returned to Virginia to be with her family. She has authored several articles on melanoma research and is an active member of the DC Dermatologist Society. Dr. Abramova has special interest in prevention of skin cancers and general dermatology. And our topic for today is hair loss. So thank you, Dr. Abramova, for being here again. It's an honor to have you here with us. And talk to us a little bit about hair loss. How common is it in the general population?
Well, I see hair loss in my clinic patients every day. I think at the end of every visit that I have, at least a few times a day, somebody asks me, oh, by the way, can I ask you a question about my hair? I've been shedding and I've been losing quite a lot. And whether a patient truly experiences hair loss or they just experience a normal amount of shedding, it always comes up as a topic. So I think it's one of the most common things that I see in dermatology, and I see it in both adults and I see it in pediatric patients as well. There's different types of hair loss that one can experience.
Okay, and talk to us a little bit more about that. What are the differences?
Yes, so it just depends. There's two types of hair loss that we usually look at. There's scarring hair loss and non-scarring hair loss. And when we talk about scarring hair loss, and when you see a little bit of redness around each hair follicle, so when patients examine their own hair, they'll see that around each hair follicle there is a little bit of redness and a little bit of inflammation. That type of hair loss is really uncommon, but if diagnosed early, it can be corrected. There's non-scarring hair loss, and those are usually androgenetic alopecia, alopecia areata, and telogen effluvium. Those are more common types of hair losses, and that's what majority of my patients presented with. Androgenetic alopecia is something that you see in both males and females. Female pattern hair loss, when you see a lot of frontal thinning, that's what you notice in one patient. And then male pattern hair loss, that's so common. We probably see it in majority of our patients, male patients by age of 50, some type of thinning of the hair. In children, it's usually alopecia areata when hair just falls in big patches, and they will present with like one or two of those oval patches on their scalp. And then telogen effluvium, that's when you shed a whole lot of hair. It especially happens right after somebody had a baby, or they had stressful episodes in their life, they've been sick, they had experienced hospitalizations. So those types of hair loss are associated with telogen effluvium. And that's when you notice a whole lot of hair in the shower, and you see it in the corners of your house, and you're like, oh my God, what's happening?
So what type of treatment can be done for someone who does come in and say that they have this going on?
So it just depends. First thing that we probably need to do is figure out what type of hair loss they're experiencing. And so I usually order some blood tests initially, and just to check their iron levels, their thyroid tests.
So you got to find the source first.
The source, like we order the estrogen, progesterone level, testosterone level, just to make sure nothing is out of normal. And once we do that, sometimes I offer patient a biopsy, because sometimes even if the blood work is normal, you still need to figure out why they're losing so much hair. So we do a small biopsy of a scalp and get to the bottom of it. And once we sort of figure out what's the diagnosis is, then we can proceed with a treatment.
And so the treatments, what range of treatments are there? Is it just a medication that someone can take?
Treatments are sort of like, it tailored to every individual patient. Every patient deserves their own look. So sometimes we offer just minoxidil, which is Rogaine. And everybody heard about Rogaine, but everybody's sort of scared to use it. They're like, oh my God, but once I start using Rogaine, I'll be on it forever. And I say, well, what's the alternative? Sometimes we just have to start using it early enough so we stop shedding.
Now, Rogaine, is that over the counter? Or
it is over the counter treatment, and sometimes it's recommended in some of our alopecia patients.
Okay.
Other treatments are a little bit more like prescription medications.
Okay.
And that would be for hair loss in males, we prescribe Propecia. And Propecia is a medication that blocks the conversion of one testosterone to more active form of testosterone, which sort of results in more aggressive hair loss. So Propecia is one of the pills that we can offer to our male patients, but never to our female patients.
Okay, so the females don't have an option to take that.
Well, I mean, I think that they can, as long as they're not planning to get pregnant anytime or ever, because it's such a teratogenic medication, meaning it causes severe birth defects.
I see, okay.
For females, there's a pill called aldactone, spironolactone, which is an old blood pressure medication, but it's also sort of anti-testosterone medication. Once again, should not be taken when one is planning to get pregnant.
Right.
But if there's no such plans, then it can be safely taken and carefully monitored. There are few side effects that are associated with both of those medications. So we do have to sort of do blood work before we start those medications and monitor them carefully while they're on it. I do also refer them sometimes to primary care doctor to get the blood work done, and sometimes just to see if they're good candidates for it, if there are other multiple medications. Sometimes we inject steroids to help with our scarring alopecia. Sometimes we apply topical steroids for our like psoriatic patients that are losing their hair, or for our eczematous patients that are scratching a lot. And you know, there's have been a lot of talk about lasers in hair loss.
Okay, so this is a new treatment then?
You know, it's sort of been around for like past 5-6 years, and FDA has not cleared it completely yet. They nodded to some of those lasers, but they've not said, oh yes, they absolutely work. So when I recommend somebody to get any type of hair devices for their laser devices for their hair loss, I sort of say it with hesitancy because I don't know the full impact of it, and I don't know if they're going to deliver the promise of bringing back the hair. So I'm very careful. So, and I do want to mention one last thing with the newest and the latest, which you hear a lot about in our news with hair loss, is a medication, is injectable called PRP. Okay. A lot of people use it for treatments of other disorders, plasma-rich platelets. And what they do is you get a little bit of blood out of patients' veins. You just get a little bit of blood, and then you spin it and inject it into the scalp. And that's supposed to promote hair to regrow. Okay. Once again, it's a little bit controversial because there's not a lot of study that show it's completely beneficial. There have been a few, and a lot of dermatologists are starting to look into it and to start doing it. It's always out of pocket, so it's always hard to say, go ahead and spend all this money on doing it, because there has never, well, I don't want to say never, there's not been conclusive research studies that show that it works well.
Okay, but this is the plasma that's causing or enabling the hair to grow where it is working for patients.
Exactly. Those platelets really have lots of growth factors in those, and whenever they get delivered directly to the hair follicle, they promote the increased growth of the hair.
Okay, so interesting. That's very interesting.
I know,
okay, so maybe we'll see going forward if the FDA will approve that and see if that's something that patients will have an option.
Yeah, it's all off label now, but I'm really excited to see bigger studies that are done with PRP to see if it really works.
Okay, and then what about someone who's trying to go maybe the natural route? Are there any types of options for them if they don't want to do medications or any type of procedures?
You know, a lot of people ask, what about vitamins? What about hormones? What can I do that can naturally increase my hair to grow? And you know, there's no known vitamin that causes the hair to grow back. A lot of people spend a lot of money on biotin.
Yeah, you see a lot of advertisements
yes,
for
like
that.
Biotin for nail and hair growth. But once again, biotin is has never been proven to be helpful for hair loss. Because majority of us are not deficient in biotin. As long as you're, not pure vegan, I think you're okay. But if you want to supplement, it does not cause any significant problems increasing your biotin intake. Of course, it's good to maintain healthy diet. I think it's really important to eat well and increase your protein intake, especially if you are vegetarian. Take just for our females normal prenatal vitamins, because sometimes we become deficient in iron and folic acid. And it might increase some of the hair to come back,
Okay.
but once again, never been proven that any of those vitamins help regrow the hair.
Okay.
So
it might maybe strengthen or maybe prevent, but obviously if it's an issue that you're really having with alopecia, it's best to come and see you or see a dermatologist that
see a
can help you.
dermatologist, and especially for our scarring alopecia, the sooner we diagnose them, the better it is, because some of it could be related to the products that patients are using. Sometimes
see.
it could be related to the styling processes that they're doing.
Okay.
If we do a lot of relaxers, if there is lots of heat and flat ironing the hair, it can cause breakage and damage to the hair as well.
Okay.
So the sooner it's recognized and diagnosed, and the sooner it can be stopped, and we start injecting steroids or doing topical steroids, the better the outcomes will be later on.
Okay, great. So thank you so much, Dr. Abramova.
Thank you for having me.
It's been really great to have you here.
pleasure.
And we've learned a lot today. Thank you for joining us here at Virginia Medical Updates. My name is Alejandra Gonsalves, and we'll see you again next time.